Just days after the Ministry of Health threatened to take legal action against healthcare workers who take industrial action, the Guyana Public Service Union is threatening to up their level of action with the support of 500 healthcare workers countrywide. According to the GPSU, this is necessary as the deaths of a doctor and an emergency medical technician and the hospitalization of several healthcare workers for COVID-19, coupled with the request for better working conditions, better pay, and risk allowances, continue to be placed on a back burner. President of the GPSU Patrick Yard stated that a full-scale strike by healthcare workers can be expected on Tuesday. However, this is subject to change if the GPSU receives a positive response for discussion from the government.
Unless these concerns are addressed, the union would not only support the escalation of what is taking place, right, but for it to be intensified.
During the press conference called by the union on Thursday, when questioned about what the GPSU considers a positive response, Yard only said, I quote, "We'll exercise a judgment on that," end of quote. Meanwhile, the GPSU president dubbed the $150 million allocation in the 2020 budget for healthcare workers' pay risk allowance as, I quote, "measly chicken feed," end of quote. This is against the backdrop of $650 million being disbursed for the Guyana Sugar Corporation before the 2020 budget was passed and mass budgetary allocations being allotted for the repainting of State House and replacing of state vehicles. Yard stated that such moves by the government would have contributed to healthcare workers seeing themselves not as public servants but public slaves.
Is Gaisuko more important than the health sector, the healthcare workers? And then we're told in the budget another $3 billion plus is there for Gaisuko. Right? Now, all these things were provocative, and all these things contributed to the anger and the emotions that prevail.
The union alleges that nurses were being asked to take home gowns to wash and asked to reuse disposable masks. The first vice president of the GPSU, Don Gardiner, added that the health workers continue to face COVID-19 threats at the hospitals.
We were informed that there is a batch of Cuban doctors at West Demerara Regional Hospital, of which, if not all, most of them were tested positive for the coronavirus. During the time they were waiting on the results, they were still at work. When the results came, 9 days after, they were asked to report to duty. They refused and they asked to do a second test, and they were denied of doing the second test.
Minister of Health Dr. Frank Anthony and Chief Executive Officer of the Georgetown Public Hospital, retired Brigadier Lewis, have been issued the fresh ultimatum of ensuring that all health workers, particularly those at the GPHC exposed to dealing with the public, must be characterized as frontline workers and benefit from risk allowance or face strike action, according to the union. Last week, hundreds of healthcare workers in regions 3, 4, 6, and 10 rallied in the vicinity of the various hospitals to agitate for improved working conditions and emoluments. For the HGP Nightly News, Amel Griffith.